Hello, we're Team Innobal, and today we will introduce our solution to improving elderly care in the Asia Pacific. My name is Dixon.
I'm Kelvin.
I'm Toby.
Hi, I'm Cole.
Hi, I'm Renee.
I'm Trami.
We are first-year students from the University of Hong Kong, pursuing a Bachelor of Arts and Sciences in Global Health and Development degree. Our team's objectives are to promote positive psychological well-being, along with alleviating pressures brought by an aging population to an overstretched public healthcare system in Hong Kong. But before we get into our solution, let's take a look at the scope of the problem.
In the year 2019, a 10-year prospective cohort study revealed that the prevalence rate for depression in the elderly population in Hong Kong was found to be 10.3% for men and 12.8% for women. Depression and poor mental health is associated with environmental factors such as multiple object losses through death, disabled spouses, drug abuse, and alcoholism. These not only pose physical and mental health problems for the elderly population, but also present knock-on effects on increasing the burden on current healthcare systems and societal development.
We think factors behind poor geriatric mental health could be categorized into two things: intrinsic factors, those that naturally comes with age, such as fear of death and underachievement, and external factors, how societal cultures and the health system may induce a sense of negligence and solitude towards the elderly.
So why choose to focus on mental health? Well, our team recognizes the impacts of poor mental health is often greatest on the immediate family and close relatives of the elderly person. They will have to devote much of their time from work and leisure to care for them, and those in the workforce have claimed that they feel socially isolated because they are unable to attend social events. As a result, it's a common decision for many families to send their elderly to nursing homes. However, this decision to send them to nursing homes is not a permanent fix, as sometimes feelings of loneliness arise in them as a result of this decision. Therefore, this suggests a burden for their immediate family members and a need for a more context-appropriate solution. Secondly, poor or worsening geriatric mental health could be costly for public healthcare systems. According to the Hong Kong LegCo's 2018-19 budget report, the city's expenditure on elderly healthcare services is estimated to triple by the year 2064. To add on to that, Hong Kong's implementation of elderly healthcare vouchers is an example of high government expenditure. It was introduced to encourage the elderly to use more private healthcare services and spend on preventative care to relieve the burden on our public hospital system. However, there seems to be no studies to suggest that the voucher scheme has any significant effect on reducing this burden, and a more pressing matter is that such government spendings on vouchers are estimated to quadruple in the future. So it is clear that a more cost-effective intervention is needed.
We chose Hong Kong as we think its demographics and health system make it a typical example in this issue and a good model for future references by other regions.
Our team has decided to take a positive psychology approach in improving elderly mental health in Hong Kong. It is deemed to be a cost-effective means of reducing disease burden in elderly, and this is shown through several desirable outcomes, such as increased levels of self-reported happiness after interventions, improved cardiovascular health, and boosted immune functions. Many of these studies have shown that there is a negative association between happiness and morbidity, and we believe that this could be an indirect way to alleviate the healthcare system burdens. We chose to use PERMA, a model that consists of the foundations of happiness and well-being in the field of positive psychology. Positive emotions, engagement, relationships, meaning, and achievements. These building blocks can help the elderly population build a life of positivity in interpersonal relationships, self-perception, and to lead a meaningful life. We have designed the program accordingly to this foundation, and our end goal is that we hope for all elderly who go through our program to be able to foster good mental well-being within themselves and in others.
Making use of the PERMA model, a scheme is proposed to promote elderly mental health. The Mental Improvement Scheme for Elders, in short, MISO, targets on people in the 60s or above. Considering only half of the population, about 65, owns a mobile phone in Hong Kong, technology and face-to-face components will both be included to ensure higher coverage of our program.
In our program, improvement of psychology states and promotion of positive aging is expected to be achieved.
So the first way is what we call Spectacular Opportunities for Unity Project, SOUP in short. Not only can this face-to-face workshop improve our older adults' quality of life, but it can also aid the establishment of connections between older adults. It is put in practice in the later 4 years of plan, so the first 2 years with smaller group numbers for quality control, and most importantly with proactive invitation of older adults from nursing homes and community centers. The later 2 years, our scale of projects will be enlarged and is open for public to apply. This entire SOUP project is held annually and its workshops are held weekly. In essence, the project includes 6 months of short-term activities and 6 months of long-term activities. All these activities specialized for older adults are designed under the PERMA framework. PERMA Profiler will be used for assessing participants' state of well-being throughout the project. This PERMA table shows different PERMA aspects, each with the corresponding sub-themes that are used as references for organizing activities like reminiscence workshops, dancings, and Pilates for participants.
For the technology components, an app targeting elderly named AgeGood will be developed. It enhances the effectiveness of face-to-face program and allows it to reach more people. Mainly, it acts as a discussion platform for elderlies, and users can receive updates of activities from other organizations or community centers. While the app can also help in encouraging participation of face-to-face program by counting the hours of participation and allowing the hours to be exchanged into rewards. User-friendly design will be used for facilitating elderlies using this app. Voice AI and voice typing system will also be included in the app.
So here's our timeline. We separated our program into 4 phases. In Phase 1 preparation, we aim to recruit staffs and invite participants. Phase 2 pilot program will mainly conduct baseline assessment using a survey called PERMA Profiler and do impact measurements to examine and catch potential problems of our program. Phase 3, we plan to increase the scale of the program by recruiting more elderly centers and do a larger scale promotion. Phase 4 will evaluate and refine our program and organize long-term activities on all 5 aspects of PERMA. We hope that more elderly can benefit from our program and improve their psychological well-being.
During the program operation, there are several expected challenges which can affect the efficacy. First, given the conservative mindset of older adults, it's not uncommon that they need more time to accept new things. Besides, even though these older adults have basic skills using mobiles, they might not be able to use such new apps. Furthermore, negotiation with enterprises and organizations for collaboration will be another big issue due to the nature of the program. Last but not least, there's always a privacy issue regarding the personal information that are collected in the program.
To measure the impact and success of our program, we will be implementing the REAIM measurement framework. For reach, we will calculate the percentage reach among our target population in Hong Kong. For effectiveness, we will be using the PERMA Profiler, HKU4, and APRU surveys on all our participants. For adoption, we will look at how well it's been accepted by community centers through giving out surveys. In implementation, we will look at the cost efficiency and consistency of our program in looking at financial reports and maintenance through gauging the government's interest in supporting our program any further beyond the stipulated 5 years. For the effectiveness components of our REAIM framework, this will be assessed through 3 distinct questionnaires provided to our participants. Firstly, the PERMA Profiler, a measure of one's positive psychological well-being, basically gives us a general outlook on how well the patient has been doing according to the PERMA model. Secondly, the Aging Perceptions Questionnaire, which is a measure of one's perception of aging via 4 domains of timeliness, consequence, control, and emotional representation. Thirdly, the PHQ-4, or the Patient Health Questionnaire 4, is a 4-question ultra-brief screening for anxiety and depression. These will all come together to help provide insight on looking at how well our program has actually been for our participants.
For the payment for the manpower, we need 2 full-time research assistants to analyze the data collected from the PERMA Profiler. We expect that each research assistant will be paid at $2,500 per month. We also need 240 sessions with part-time psychologists in order to help us interpret the results from PERMA Profiler and to advise us on how to improve the program. We expect a psychologist will be paid at $150 per session. For social workers, according to a study from PayScale, the hourly salary of a social worker is around $22 per hour in Hong Kong. We expect that each community center needs 2 part-time social workers for this program. For the payment for the manpower, we need 2 full-time research assistants to analyze the data collected from the PERMA Profiler. We expect that each research assistant will be paid at $2,500 per month. We also need 240 sessions with part-time psychologists in order to help us interpret the results from PERMA Profiler and to advise us on how to improve the program. We expect a psychologist will be paid at $150 per session. For social workers, according to a study from PayScale, the hourly salary of a social worker is around $22 per hour in Hong Kong. We expect that each community center needs 2 part-time social workers for this program.
This brings us to the end of our proposal. We hope that the ideas presented here today can serve as more than just a concept, but also as an opportunity to make a reality in improving global elderly care. Thank you on behalf of Team Innobal.